This is an Eyewitness News special presentation. COVID impact 5 years later.
Mask mandates and social distancing might be over. Schools and businesses may be back open, but make no mistake, COVID changed America and changed Americans.
It takes a toll. I died 3 times.
Had it not been for the COVID vaccine, we'd not be here.
Now, 5 years later, the impact is still being felt in the classroom, in the workplace, even in the way we interact with one another.
I was isolated, and I would isolate myself from everything else.
Tonight, I'll look at the lessons we learned and how they will shape our future. It was 5 years ago tonight when Sade began the 11 p.m. newscast by saying, and I'm quoting now, "The world around us is seemingly grinding to a halt."
March 12, 2020 was the day most of us came to the realization that COVID-19 was going to impact every single aspect of our lives.
And we were right. Everyone was right. We watched first in shock as the world shut down around us, and then in horror as the death toll hit unimaginable numbers.
And 5 years later, we are still living with those memories and some of the effects of the pandemic. In fact, a sign from several years ago still hangs prominently outside Elmhurst Hospital, the epicenter of the city's pandemic response.
Sure, we have begun traveling once again, gone back to the barber, stopped hoarding toilet paper, remember that? But we work differently, we socialize differently, and we deal with viruses differently.
And we're going to explore all of that over the next 30 minutes, going inside hospitals and classrooms to see how they have changed. And we're also going to explore some of the long-term health effects of COVID while revisiting some of the doctors, patients, and heroes we met 5 years ago.
But we want to begin our coverage with Eyewitness News anchor Mike Marza. He is live in Times Square with a look at COVID's lasting impact on all of our lives. Michael?
Bill and Sade, the people have returned to Times Square, which is pretty incredible considering I stood in this very spot back in 2020, 5 years ago. And boy, was it eerie and quiet right after the shutdown began. It was so quiet you could hear the bristles of a brush cleaning the empty street. Of course, it is impossible to wipe away all of those memories, both good and bad. A time when the world changed forever.
Several breaking developments tonight in the coronavirus outbreak.
When the streets emptied, there will be more cases of the coronavirus here in New York. In buildings shuttered. The wail of sirens and the 7 p.m. claps for those essential workers echoed from Staten Island all the way to the Bronx. Now, 5 years later, nearly 65 million tourists visited the city last year. The crossroads of the world now clogged again, with more than 300,000 visitors a day. Hundreds of businesses have opened here. The lessons we learned 5 years ago are still being lived today.
We've seen restaurateurs who didn't open one restaurant, but have opened up 2 restaurants in Times Square since the pandemic.
After being told to stay home for so long, it's been hard to lure some people to leave. It's where they bought Peloton exercise bikes and were forced to cut their own hair. Or not.
I go like this, and it gets wild.
And binge watch shows like Tiger King.
It's not every day that a zookeeper went to prison for murder for hire.
Or expanded their family. 23 million Americans, that's 20% of households, adopted a dog or a cat during the pandemic.
And of course, we all spent way more time online, learning what to do with our video call backdrops and learning about this thing called Zoom, something that would revolutionize education and the workforce, perhaps forever.
I think hybrid is here to stay. So I think giving people the flexibility to work more flexibly, at least one day a week, isn't changing it.
33% of Americans now have a fully remote job. 43% are hybrid. Major companies, even the federal government, now ordering employees back to the office. The Sawa's family rode out the pandemic on the east side. Do you remember the mask?
Yeah, sometimes I had to go outside wearing a mask.
The impacts on students continue. Those old school snow days are now often replaced with remote classwork days, but it's deeper than that. New York City grappling with low attendance and spikes in anxiety and depression.
And for a lot of kids, for sure, and certainly our younger kids, being online for learning was a disaster. But for some of our older kids, it worked pretty well.
Judy Ramirez's 9-year-old daughter is being held back a grade.
So now she have a lot of problems to learning math.
And Elmhurst Hospital, once the epicenter for the pandemic, with thousands of patients and where hundreds of people died, it's now screening for mental health.
Well, I think I have depression. It's no longer that stigma.
But after 5 years, one of the most indelible aspects of the pandemic remains the same: the power of unity.
We are resilient as New Yorkers. We're resilient as people.
Foot traffic here in Times Square is about 15% less than the record-setting year of 2019, but the Times Square Alliance predicts that that will be surpassed sometime next year, which is pretty remarkable considering where we were 5 years ago. Bill and Sade.
Thank you. Well, make no mistake, COVID is still present in our world and in our lives. And my guess is you'd be surprised by the following statistics.
The statistics are right here. Between October 2024 and today, so a 5-month period, the CDC estimates that 7 million people, 7 million, contracted the virus. 200,000 have been hospitalized and 23,000 have died.
23,000?
In the last 5 months.
Wow. Well, we know that COVID infections are going to ebb and flow as new variants evolve. So how do doctors prepare for that? And how have hospitals changed since the start of the pandemic? Eyewitness News reporter Anthony Johnson has that part of our coverage.
The last 5 years have flown by, but those working in hospitals recall the COVID crisis with crystal clarity.
It haunts me to this day. It really kind of just reflects how we're all humbled by this disease.
Teaneck, New Jersey was ground zero for early cases, and Holy Name Hospital became an epicenter. The ICU filled fast with very sick people suffering from COVID-19. Patients multiplied in days.
That became 4, that became 12. Before you knew it, we had 48 intubated patients. And to put that into perspective, we have an average daily census of 6 intubated patients.
A quick pivot led to the expansion of the ICU. Now it sits empty, but the memories of what happened here are still jarring. Visitors were prohibited as patients laid here wondering if they were going to make it.
The thing that stuck most with me for nurses was that we were not only your caregiver, but we were your family member.
Every hospital in the area was pushed to the brink, getting resources, protection, and having staff available to care for the sick.
We were all very overwhelmed. We were overwhelmed with the information coming, the lack of information coming, what information was right, what was wrong.
Catherine says the leadership at Bergen Newbridge Medical Center in Paramus focused on providing protection and support for staff and patients.
But we knew that the health care we provided, whether it was within our 4 walls, had to pivot. We had to change how we were providing care and services.
Now, the hospitals have upgraded new equipment to rapidly test for COVID or any new virus.
It's embracing new technologies, whether it's diagnostics like you see behind me, using molecular techniques, whether it's using AI-enabled patient-centric tools to alleviate workflows throughout the hospital.
The last 5 years have taught lots of lessons. Rooms are being upgraded to better provide for patients, doctors, and nurses.
What I learned from COVID is that you can never be set in one way or one thought. You have to be able to turn on a dime.
Prepare for the unexpected. We hope for the best, we prepare for the worst. I always tell people that in the infectious disease world, it's our job to worry so other people don't have to.
In Teaneck, New Jersey, Anthony Johnson, Channel 7 Eyewitness News.
You know, when we talk about preparing for the next pandemic, it is impossible to ignore the fact that the new Trump administration has slashed both funding and staff for agencies that deal with infectious disease outbreaks. The big question is why, and it has some local doctors more than a little worried.
A lot of the people involved in putting these things together are losing their job. The identification of the problem may be delayed, and that's a huge deal.
And a huge worry. There's also no shortage of concern about how some in the Trump administration view vaccinations. Vaccines that saved perhaps millions of people during a pandemic that killed 1.2 million Americans. Now, according to the CDC, in a stunning report, just 23% of Americans have received the latest COVID vaccine. and just 8% say they will do that going forward. By the way, those are the lowest levels in years.
As people try to move on from the pandemic, imagine still dealing with the fatigue, still dealing with the brain fog, and still dealing with the shortness of breath that so many of us experience for just a week or two. It's estimated long COVID impacted nearly 400 million people worldwide. About 5% of American adults are still living with the effects of the virus long after infection has passed. An almost continuous personal pandemic, just crippling. Eyewitness News reporter Stacey Sager spoke to a COVID long hauler.
Guess you have to go a little slower.
It's a steady ritual for Brian Jaffe here at St. Francis Hospital's DeMatteis Center in Greenvale.
So once you're ready, catch your breath.
Pulmonary rehab twice a week for at least an hour. His vitals always monitored and his oxygen a permanent appendage. A far cry from this celebratory hospital release 5 years ago.
I still have pulmonary fibrosis. I still have a narrowed airway.
Brian was a healthcare worker in what he now calls a hornet's nest of COVID exposure.
They admitted me right away, and within 24 hours, I was in a coma. The 39 days of being intubated, it takes a toll. I died 3 times.
In the past 5 years, we have followed Brian, now age 58. He's needed a pacemaker, 18 stents. He had his gallbladder removed, and it's hard to take every breath with a partially paralyzed diaphragm and vocal cord problems. It takes hours to get to and from rehab, but it's his lifeline.
If I stop for more than a day or two, I start declining fairly significantly.
Brian's doctors so supportive but reluctant to give out false hope.
Maybe most important to recognize the problem, not to ignore it, not to poo-poo it.
What do you hope people understand the most about patients suffering with long COVID?
That it's real.
The reality is there's still so much we don't know about long COVID, the neurological effects, the cognitive dysfunction, and the actual causes that doctors are still struggling to understand. What they do know, we've come a long way since the days of complete isolation and no answers.
So we want to keep them as healthy as possible. That means vaccinations, nutrition, education.
But we haven't come far enough.
We sold our home, and we sold one of our cars.
Brian can keep putting one foot in front of the other, and there's plenty that COVID can't take. His sense of humor.
I need this for my Olympic trials.
The milestones he marks with family by just being alive, even on the toughest days.
Each anniversary is a reminder of that, and it's difficult.
In Greenvale, I'm Stacey Sager, Channel 7, Eyewitness News.
Really difficult and challenging for so many.
No question.
Well, our thoughts are with you.
And that's why we're doing this today. We're just getting started, by the way, on this Eyewitness News special presentation. So when we come right back, so many of our living rooms were turned into classrooms during that first year of the pandemic, remember? And the results, well, they weren't great all the time, right? Test scores dropped, and learning loss was a very real thing. So 5 years later, have students caught up? We're going to investigate. Plus,
didn't know that I was going to be the first, and for me it didn't matter. I just wanted to be vaccinated.
Well, how can you forget her? Call it Where Are They Now? COVID edition. We're going to check in on some of the nurses, doctors, and patients we spoke to 5 years ago.
schools and students taking a hard hit during the pandemic, that we know. We all remember, for instance, those drive-through graduations for students whose high school careers ended right in the middle of the lockdowns.
Also, COVID robbed so many youngsters of what most students remember as precious school years, like time to interact in a classroom setting with peers and with teachers. We've reported about learning losses and the so-called COVID brain drain.
But where do we stand, really, 5 years later? Here's Eyewitness News reporter Kimberly Richardson.
March 16, 2020, the halls inside all public schools here in Newark went silent.
It was heartbreaking. I will cry at times.
Roughly 35,000 students were initially told to stay home for 2 weeks.
Did you want to go back to school?
Yes, I did.
Did you understand you couldn't?
Yes.
As COVID spread, weeks turned into months. nothing would ever really be the same.
We saw a huge drop in our test scores when we began testing again after the pandemic was over. Last year we were back up to where we were pre-pandemic levels. But it's taken 5 years to get there.
Amy Panich heads up Park Elementary, but in the spring of 2020, she was a first-time principal at another school in the district.
I really had to start to rethink my whole approach to teaching and to leading a school.
Virtual learning was the norm, using laptops to teach the basics to, say, kindergartners. Maritza tells me it was overwhelming.
I see that you're not holding the pencil with 3 fingers. Can you try, look at me like this. If you don't know the foundation, then how can you read? How can you comprehend? How can you test?
An example of the garden.
At the time, Janelle was in 3rd grade. Academically, she held her own, but looking back, she realizes all of this took a toll.
I went through a stage of sadness or whatever because I wasn't able to be around my friends. I was isolated, and I would isolate myself from everything else.
But even with all of the change and challenges, there were some silver linings. Jamie says spending time with his wife and 2 kids, which changed in the fall of 2020 when many schools moved to hybrid models.
I was kind of heartbroken because I'm like, oh man, I had them all this time, and you really don't have a chance to do that much with your kids because they're in school, you're at work.
On the technology front,
we are able to use it for many purposes, even just conferencing with a student, giving feedback to students.
To close that gap in learning, this district put in place a range of new programs, everything from tutoring before and after school to Saturday classes.
We are better prepared now, so definitely moving forward, the learning will continue. If something that taught us how to be, it was resilience. Like, let's take action, let's do this.
Kimberly Richardson, Channel 7, Eyewitness News.
That's something. The coronavirus pandemic, of course, has transformed almost every aspect of our lives. Coming up, we're going to reconnect with a patient of the pandemic and the barber who helped give me a new look. Their story.
Oh, yeah, I did.
5 years later.
And we're going to hear from the woman who got the first ever COVID shot on the world stage. And as we go to break, a look at the clapping for healthcare heroes. Every night at 7 p.m., people would bang pots, ring bells, and make noise out their windows or from their balconies.
Boy, you remember that?
Oh, yeah, I remember that. While its goal was to thank healthcare workers at the time of their shift change, it also became a way for isolated New Yorkers to come together for 5 minutes each night, feeling some sense of human interaction, a bit of happiness, and without question, hope. And welcome back. And they were some of the enduring images of the pandemic. And as you look at some of these pictures all around us, it is probably bringing back a flood of memories.
Yeah, it was on one hand horrible, but in terms of human kindness and working together, it was rather profound as well. If you lived in New York City, you probably remember the eerily empty streets and the sounds of sirens wailing all day and all night.
And if you lived in the suburbs, you probably remember those drive-through testing centers that were set up, sometimes people waiting hours just to get swabbed.
And as the days and months passed on and we soldiered on, we started to emerge from our homes, socially distant, of course.
And it may have felt like time was standing still, but we still celebrated birthdays, graduations, and we found ways to visit loved ones.
And then all along, first responders, doctors, nurses, EMTs, really all essential workers, well, they became our superheroes.
So we wanted to take a minute right now to revisit some of the men and women we introduced to you 5 years ago.
I was speechless. I struggled to process what I was seeing. And even to this day, it's a struggle to recall exactly to the finest detail what happened. It feels like a blur.
We met Dr. Eric Bluttinger 5 years ago as he treated a never-ending flow of patients into Mount Sinai.
I'm seeing young patients, old patients, people of all age ranges who are just incredibly sick.
5 years later, he says the pandemic made us stronger.
It can be a very painful period to look and think back on, but we feel more connected as a society for having been through it.
And we all remember Sandra Lindsay. She too witnessed the horrors at the hospital.
The patients were just pouring in, gasping for air. and begging for us to save their lives.
She used that as inspiration to be the first American to roll up her sleeve and get vaccinated.
I was not scared at all. What I was scared of is the virus, not the vaccine.
Since then, more than 270 million more people around the world got at least one dose of the vaccine.
Thank you. Bye-bye. Take care. Come and visit.
For others, like Pastor Benjamin Thomas from Long Island, well, he's thankful to be alive. He racked up some grueling medical statistics: on a ventilator for 54 days and 6 weeks in a medically induced coma.
I was basically dead a couple of times.
Today, what he went through inspired others, and he says he finds strength in his faith.
God gave us hope, and our hope is everything will be okay.
5 years ago, we were all in it together. You remember this. I sat next to Bill as his hair wildly grew out because he refused to get a haircut if our viewers couldn't get a haircut. It was kind of a bonding, and you all responded.
I go like this, and it gets wild.
He finally did when the barber shops reopened. And we caught up with the man who finally did give him a cut. And he says his shop still isn't the same all of these years later.
I'm sure it's
A lot of memories.
I'll remember it forever. You know, we certainly were all in it together, right? And when we talk about COVID's lasting impact on our lives and how we work, just ask anyone. What did you do in the pandemic? Like one of my besties, Chief Meteorologist Lee Goldberg.
It was really this monumental pivot,
Yeah.
right? I mean, with COVID spreading so rapidly, we here at Channel 7 had to figure out a way to limit the number of people in our studio. As a result, backyard weather was born. I spent months forecasting from the home, so like so many of you, transforming my house into a workplace from the office to the garden. As you know, backyard weather still lives on today, complete with Sade's backyard bouquet.
Yes, we love that. And the viewers love that.
It's fun.
No
question at all.
One of the good things.
Yeah, it is. It's a perfect example, in fact, of how the pandemic changed our lives forever. In this case, for the better.
So we thank you for joining us for this Eyewitness News special presentation. And as we said earlier, COVID is still out there. People are still getting sick. People still getting hospitalized and still dying.
We just simply cannot forget that, nor should we. As I said so many times back in 2020, and I say it to this day, we wish you health and peace. And let's take care of each other. Eyewitness News at 6 is next.